Good morning, dear students. So today we'll discuss the nutritional diseases. As in previous lecture, we discussed the physical agents in pathology. So how physical agents of environment, not only environment, but also during the treatment, can affect our body, and which side effects, adverse effects we have due to the treatment in previous lectures already discussed. And today we'll discuss the nutritional diseases. Nutritional disease, as it pointed in this book. So here you see that we have inequality in our world. So you know that in some of developing countries, developing nations, they have a very hard struggle for life just because of food, because of insufficiency of food, and a lot of people starving. Yeah, and it's became a steady word completion that people starving in Africa, yeah, and in other hand we have developed countries where they struggle against obesity, yeah. So when obesity causes a lot of pathology in developed countries, and sometimes it happens even in one country that some people in one country they live in their very excessive food intake, yeah, and they try to restrict themselves with the food, and they try to eat healthy food, but same way in their own country they have a lot of people who are restricted with the calorie intake. And now we'll discuss both of these cases, if increased nutrition and decreased nutrition of these patients, of these people. And first of all, I want to start with malnutrition. Um, Malnutrition. So malnutrition is before talking about malnutrition, we have to discuss what is a healthy diet. Healthy diet provides, first of all, sufficient energy in the form of carbohydrates, fats, and proteins. You know, we have daily metabolic needs and daily metabolic demands, and there we can handle it only by intake normal amount of carbohydrates, fats, and proteins, and their normal absorption. So also don't forget that it's not enough just to eat it. We need to absorb it also and use it in our body. And okay, then in next health diet is essential amino acid and fatty acid used as building blocks for synthesis of structural and functional proteins and lipids. So you know that some amino acids are essential in our body, and we cannot produce them by ourselves. Our metabolism doesn't produce it in normal amount. It doesn't produce it at all, and we can take it only of outer environment. And also third one is vitamins and minerals intake. Vitamins and minerals intake. So that minerals we so minerals and vitamins, they also can be obtained only by digestion of them and normal absorption of them, because even sometimes vitamins and minerals are not absorbed properly, and it's causes these deficiencies in vitamins and minerals. We'll discuss them also very soon. So starting from this point, I don't add students to the meeting. So primary malnutrition, one or all of these components are missing from the diet. Primary malnutrition is in other words, it's starving. Yeah. So when a patient don't eat enough food, so it doesn't matter. It's carbohydrates or amino acids, proteins, and vitamins. So this all these components are missing, or few of them are missing from the dietary. But in secondary or conditional malnutrition, the dietary intake of nutrients is adequate, and malnutrition results from nutrient malabsorption, impaired use of storage, excess losses, or increased requirements. So, for example, dietary requirements for example, doctor, yeah, who is living and who is don't work hardly with their muscles, don't work, so workload is very low, or might be might be people who work in offices. They don't need a lot of nutrition. They don't require a lot of calories. And for them, it's for example,
Excuse me, sir.
2,000 calories is enough. But for
Sir,
people,
share your
Sir,
screen. Sir, we
sorry.
can't see your screen, sir.
Oh
Share
yeah.
your screen.
Oh, okay. Sorry. I thought I shared it. Thank you that you mentioned it. So once again, primary malnutrition, it's missing all the components from the diet, few or all of them, and few of them lost, yeah. Or and secondary, or also known as conditional malnutrition, its intake of nutrients is adequate, but due to malabsorption, impaired use or storage, excess losses, so it causes increased due to increased requirements. Yeah, and as I said, yeah, so that different people need different requirements. So if people is working on in a gold mine, for example, no, or any mine, charcoal mine, they require much more energy. They require much more calorie intake and also vitamin intake. Also, people who live in a cold environment, they have a much larger requirements for calories. So that's and that leads to so this might in these patients in these people, they normally intake normal for office worker, for example, but they have increased requirements, and it leads to malnutrition in these patients. Okay, causes of secondary malnutrition can be grouped into three general but overlapping categories: gastrointestinal diseases, chronic wasting diseases, and acute critical illness. So, okay, all of them we'll discuss later. Okay, malnutrition is widespread and may be gross or subtle. Some common causes of dietary insufficiencies are listed here. So we see poverty, poverty, it's like homeless people, so elderly persons and children of the poor often suffer from severe malnutrition as well as trace nutrient deficiencies. In poor countries, poverty together with droughts, crop failure, and livestock deaths creates a setting of malnourishment of children and adults. Then next dietary deficiency is ignorance. Uh, so so okay, let's read. Even the affluent may fail to recognize that infants, adolescents, and pregnant women have increased nutritional needs. Ignorance about the nutritional contents of various foods also contributes to malnutrition as follows. It's first iron deficiency, often develops in infants exclusively fed artificial milk diets. So because breastfeeding is much better for them, because all necessary nutrients are collected in milk, mother's milk, than in artificial milk. Polished rice used as a mainstay of a diet may lack adequate amounts of thiamine. So you remember it's group B vitamins, and they are also lacking in this person. And iodine often is lacking in food and water in regions removed from the oceans unless supplementation is provided. So, and our country and the northern parts of your country, they are also affected with this iodine deficiency, and this disease. It causes iodine deficiency. Uh, so all of you heard about it. Then chronic alcoholism. As we discussed before, chronic alcoholism, so it works in both in two ways. So alcoholism also impairs the normal, adequate intellectual abilities, and that's why patients don't eat proper food. They ignore the normal food intake, and or in oppositely to this, they suffer with malnutrition because of lacking some vitamins like thiamine, pyridoxine, folate, vitamin A, and it also results in a dietary deficiency. Along with it, so gastrointestinal absorption is lacking there. So because of we discussed it in alcoholism, that it causes defects in gastrointestinal tract, and nutrient utilization is also a challenge there, and of course it leads to failure of absorption. normal absorption and usage in the body. Failure to recognize thiamine deficiency in patients with chronic alcoholism may result in irreversible brain damage. And this irreversible brain damage we also discussed before. It's a Korsakoff psychosis. So we'll more discuss it in chapter 23, so which is a neurological condition, neurological diseases. It will be discussed, I guess, in next year. Then acute and chronic illnesses. So there are a large set of diseases which cause malnutrition, malabsorption, and utilization of some components which very strongly required for the healthy person. So, for example, basal metabolic rate becomes accelerated in many illnesses. For example, with extensive burns, resulting in increased daily requirements of all nutrients. Failure to recognize these nutritional needs may delay recovery. Malnutrition is often represented in patients with advanced cancer and AIDS. So, and the mechanism of this we discussed before. So it's related to increased, in case of cancer, it's caused by increased circulatory TNF, tumor necrosis factor, which fails the center of nutrient center in hypothalamus, so which decrease appetite of these patients, which cause a cachexia. So, and then the cachexia we'll discuss a little later. And in AIDS also a lot of damage happened, which in the end cause decrease desire of food. So self-imposed dietary restrictions. We have anorexia nervosa, bulimia, and less overeating disorders affect a large population of persons who are concerned about body image or suffer from an unreasonable fear of cardiovascular disorders. About anorexia and bulimia, we have a separate section here. And we have a lot of other causes, include gastrointestinal diseases, which cause malabsorption, and this we'll discuss too. Acquired and inherited malabsorption syndromes, specific drug therapies, with block uptake or use of particular nutrients, and total parenteral nutrition. So you know that now we have very evolved parenteral nutrition for patients who are unable to eat it by normal digestive tract, by normal activity of digestive tract, but still parenteral nutrition is very evolved. Now we have a very good parenteral treatment, but anyway, it doesn't affect all needs of patient in the requirements. Okay. The remainder of this section presents a general overview of nutritional disorders. Particular attention is devoted to severe acute malnutrition, anorexia nervosa, and bulimia, deficiencies of vitamins and trace minerals, and obesity, with a brief consideration of the relationships of diet to atherosclerosis and cancer. Okay, let's talk about severe acute malnutrition. So severe acute malnutrition is let's talk about World Health Organization. So it defines severe acute malnutrition as a state characterized by a greatly reduced weight or for a high ratio that is below 3 standard deviation of WHO standards. So here we have some examples. So let's skip it. You understand what is it, and which diseases are caused by this severe acute malnutrition. They are marasmus and kwashiorkor disease, and differences between them we'll discuss soon. So this is a typical example of marasmus. So marasmus, and we'll discuss it in details. And this is kwashiorkor disease. This is and both of them are, and you can mention both of them descended from Africa, and because it's very common in Africa. So because the population in Africa increases very high, but amounts of food are very restricted there, and that's why children usually a lot of large population of African people are starving, and especially in childhood it looks a very disastrous situation there. Yeah. Let's talk about marasmus. So this diagram, so this A diagram here, it's a typical appearance of marasmus. So marasmus is a condition when intake of it's a decreased calorie intake to the patient. So when total, so you see calories are very restricted there, and then you can see here the absence of fats. So fats are not deposited. You remember that everyone who ever seen the child, yes, or in early period, you can see that they have usually they have very thick. So pretty thick layer of fats under the skin, but here we can see even ribs are visible here because of lacking of fat production. So this fat padding is necessary not only for energy storage but also um, increase the body weight, so it decreases the loss of energy by the body, so with the heat energy of the body, and lacking of this, so of course causing a lot of changes. Okay. uh, Visceral protein compartment, which presumably is more critical for survival, is depleted only marginally. So serum albumin levels are either normal or only slightly reduced. So you see that it's in case of marasmus. So we have pretty similar pretty deficiency of all nutrients. All nutrients, doesn't matter which nutrient is it, and that's why all components are reduced, and there are no deficiency in proteins. Yeah, protein deficiency is also there, but so okay, 1 minute. Protein deficiency is also there, but due to decreased production of other components, so it's pretty stable, and then that's why albumin levels just slightly reduced because all components are less produced. And of course, it will cause the immune deficiency because of lacking protein synthesis and normal activity of the body, and immunity works not properly. So it's a very how to say it right, multi-step process of marasmus disease and how it affected the body. So that's we have a lot of different manifestations depending on which deficiency of which components are present there, and that's why we have different appearance of this marasmus. Okay, and let's talk about kwashiorkor. Kwashiorkor occurs when protein deprivation happens. So you see, kwashiorkor, when we have normal, so calorie intake might be decreased or might be even normal, but you know that in during the dietary during the diet they need to intake not only carbohydrates. Carbohydrates are usually the cheapest nutrients which are present, and a lot of children are suffering with it because they give enough amounts of carbohydrates, but not enough protein intake to the body. So it's kwashiorkor. It's derived from Ghana language of Ghana. So where illness in a baby that appears after the arrival of another child. So you know that in Africa it's very common to have a lot of children in one family, and when the first child is grown up and don't take breastfeeding yet, then proteins are deprived, and they start eat only cheap food. And that's why it's known as kwashiorkor. And first of all, it affects the chronic protein loss. Chronic protein loss is or non or proteins are not absorbed in patients. Okay, so actually I invited administration. So and it leads to protein losing enteropathies, nephrotic syndrome, and aftermath of extensive burns. So rare cases of kwashiorkor resulting from fat diets or the replacement of milk by rice-based beverages have been reported in the United States. So actually, you know that mainly protein intake to the body goes from meat. Yeah, so eating of meat, and meat is extremely more costly so it's really more expensive than carbohydrate meal, and that's the reason of kwashiorkor disease in Africa. But sometimes you know that we have a lot of vegans, yeah, and these vegans they try to replace the normal milk with the rice-based beverages, and that's why sometimes even in the United States this kwashiorkor disease might present. So we have some few cases in the United States which are reported with this disease. Of course, children require proteins, and even in the case of a vegan diet, we can arrange the proper amount of amino acids intake by child. But in cases of so little mentally ill parents, so they can don't give a proper amount of food for them. Okay. And so what is the manifestation of this? First of all, its main symptom is hypoalbuminemia. Hypoalbuminemia, which causes generalized or dependent edema. So as you see on this diagram, you see edema is present all over the body. And actually, we have more diagrams. You can check the kwashiorkor disease in Google pictures. You can see a lot of African descendant people with a very large stomach, so very increased abdominal cavity. Because of what? Because peritoneal cavity is due to effusion of peritoneal cavity with the decreased albumin level. So due to decreased albumin level, colloid osmotic pressure of blood is decreased, and it leads to extravasation of fluid into the body cavities, not only in the peritoneal cavity, also in pericardial or pleural cavity effusions, but they are more abundantly present in peritoneal cavity because uh, just because it's the walls of peritoneal cavity are much more abundant and stretchable. Okay.
Sir,
Yes.
sir, if these people provide enough glucose, sir.
Hmm.
So, sir, those glucose through sir Krebs cycle, they can convert it into many amino acids, sir. So they cannot help those pupils
Uh,
and reduce their protein deficiency.
Okay, I understand your question. So yeah, you can yes, as we discussed in topic of cancer. Yeah, so we discussed the metabolic changes. Yeah, and that during the mitochondrial function, we also can produce proteins even from glucose. Yeah, you talk about this Warburg effect. Yeah, and why this Warburg effect is not activated in these patients. Yeah. So, but actually, point is that in case of malignant growth, yeah, they get enough glutamine, this amino acid which can be a donor of amino group. So, and only with a proper amount of amino group, we can produce a necessary amount of non-essential amino acids. And but here they don't have any amino acid intake, and they have a deficiency of amino group in the body, and that's why even if we activate this process of which similar to Warburg effect, so it won't lead to produce proteins. So because we
Yes.
have no amino groups. Yes.
Yes. And sir, also, sir, the problem for essential amino acids, they are that are not produced
Yes,
in the
yes,
body.
yes. It is a problem. So if in case of cancer, yeah, they just uptake of this essential amino acids also increased. But in these patients, they don't have essential amino acids at all, and of course, proteins are not properly deposited, not properly produced in these patients. Okay,
And sir,
yeah.
government is responsible for it.
Okay, it's political thing, so to discuss. So of course, it's a political problem because actually we had a lot of cases. You might be heard about this case when if I'm not mistaken, might be a confuse country, but might be Zambia. it's African country. So for them, U.S. government, they provided them. So please grow out the rice, genetically modified rice for their people, because this rice contain necessary amounts of amino acids and vitamins. Vitamins and amino acids, which are, and they can feed their children only with this rice, and it will lead to normal intake of, not normal, but increase, improve the normal intake of vitamins and amino acids. But government actually avoid, so they just restrict this genetically modified rice to their peasants. Yeah, and that's why the government decision of government led to worsening of situation with this kwashiorkor disease. So yes, of course it's first of all it's related to political situation, of course. Okay, and then and also in kwashiorkor disease, so you remember that intake of glucose, intake of carbohydrates, it can if with the absence of amino acids, with the absence of amino groups intake to the body, so these carbohydrates should be deposited, and first of all they deposited in glycogens as we discussed, but also but if too excessive amount of carbohydrates are collected, it causes the formation of fatty liver, formation of fats from the glucose. You remember this biomechanism from biochemistry. Yeah, this acetyl coenzyme A is produced, and this acetyl coenzyme A is if excessive amount of this acetyl coenzyme A are produced, so they cause the formation of fats inside the liver, and it causes the formation of lipoproteins in the blood. But we have no proteins proper, yeah, and that's why fats are deposited first of all in liver, and that's why that also increases the swelling of peritoneal cavity due to hepatic failure. So it's not acute hepatic failure here, but anyway, so it increases, it challenges the proper circulation in abdominal cavity, peritoneal cavity, and that's why we see this appearance like shown here. So with a very enlarged peritoneal cavity. Okay, and then okay, as in marasmus, vitamin deficiencies are likely to be present, and as are defects in immunity and secondary infections are happening in these patients. So, of course, any malnutrition first of all affects infection, because in fact affect immunity. I mean, because immunity system is very well aligned, as we discussed it in last topics. In immunology topics, so you remember that it requires a lot of different proteins, and if we have insufficiency in some amino acids, of course, its immunity cannot be handled, cannot be supported properly, and no proper amount of at least antibodies are produced, no proper amount of no proper amount of cell membrane proteins of T lymphocytes are produced, not proper amount of complement system are produced. Of course, it challenges the normal immunity state, and of course, secondary infections are produced. Secondary infections are presented in these patients very commonly. Kwashiorkor. So you see the main difference between kwashiorkor and marasmus is that in kwashiorkor we have much even in normal intake of carbohydrates, so we have decreased amount of proteins. Okay, and then let's talk about secondary malnutrition. So secondary malnutrition, so let's talk about it on example of United States. Secondary malnutrition often develops in chronically ill, older and bedridden patients. It is estimated that more than 50% of elder residents in nursing homes in the United States are malnourished. So 50% in United States. It's one of the most developed countries of the world, yeah. And even there, 50% of elder residents are malnourished. It leads to weight loss, risk of mortality. They also increased fivefold. And that's why nowadays it's blamed. Usually, children are so. I mean, yeah, children of these patients are blamed. Is it because they let them go to the care nursing homes? But actually, yeah, we have a lot of good nursing homes, where they provide normal nourishment. But anyway, so we understand that nursing homes are for parents who are not more um, who are not more necessary for their children, and that's why it can cause it increases the risk of death in nursing homes than in normal population. One of effects, of course. Particular severe form of secondary malnutrition called cachexia often develops in patients with advanced cancer. So, as I said before, in the case of cancer, so produce increased amount of TNF, the circulating TNF. So you know that TNF is used in particularly in acute inflammation. It's like one of the most common cytokine which produce in acute inflammation. But in case of cancer, they are overproduced in type 4 I mean in for the grade of cancer. So that's TNF is present in the blood, and this TNF affect activity of hypothalamus, and in hypothalamus, so uh, decrease the appetite of these patients and cause vomiting, cause nausea and vomiting after the eating, and that's and it causes degradation of skeletal muscle and cause the fat mobilization for lipid stores, and of course patients became much thinner, and you can mention it in the patients who are struggle with the cancer, so that they are very thin. Okay, hallmark so anatomic hallmark changes in uh, so 1 minute. Um, Anatomic changes in these diseases, malnutrition disease are growth failure. Of course, we have not necessary amount of absorbed material. It causes a peripheral edema in kwashiorkor, so it's very typical hallmark of anatomic changes, and loss of body fat and atrophy of muscle, more marked in marasmus and also in secondary malnutrition. Okay, the liver in kwashiorkor, but not in marasmus, is enlarged and fatty. So superimposed cirrhosis is rare. Yeah, cirrhosis is rare because cirrhosis also require proteins, and cirrhosis is very rarely happens. Okay, small bowel shows a decrease in the mitotic index and the crypts of the glands associated with the mucosal atrophy and loss of villi and microvilli. So it also happens due to absence of proteins, and that's why a treatment of these patients with marasmus or in kwashiorkor, it requires a very careful management of food. We can't just feed this person. We can't just give them a lot of proteins right now, yes, because the enzymes which are produced in digestive tract, they are proteins, and they are not properly produced. And if we give a lot of proteins to these patients, this protein won't be absorbed, won't be digested, and of course. It plus to kwashiorkor disease, it also might cause the side effect of protein intake, increased protein intake, because you know that bacteria which are present in digestive tract, they will if proteins are not digested in upper digestive tract, in the stomach and small intestine, so they won't be absorbed properly, and instead of normal body absorption of this, so it will be used by bacteria, and these bacteria, they can produce endotoxins, a lot of endotoxins due to over progression of these cells, and these toxins, they will be transported into, they can be absorbed because they're usually fatty soluble, and through the cell membrane they can penetrate into the blood, and in the blood it can affect not only digestive tract but also even brain development. So and sometimes so when not proper management of this feeding happens in patients, it can lead to brain damage. Uh, so okay, and even coma might happen after the nourishing of these people. The brain in infants who are born to malnourished mothers and who suffer from SAM during the first and second year of life has been reported by some investigators to show cerebral atrophy, a reduced number of neurons, and impaired myelination of white matter. And you see, without any genetical disorder, so this brains of these people, they are not work properly, and that's why it's not very it's not strange here that in Africa average IQ is reduced in relation to European countries and Western countries. Yeah, and that's it's not about racism. Yeah, it's not about typically, yeah, European people in 19th and beginning of 20th century used to explain that Africans are less intelligent than European people. But they are less intelligent not because genetical tribes here, but just because of malnourishment, and they can't properly evolve the brain. And that's of course African descendant people, they are less intelligent. And even in America, in United States, you know that till 50s they have segregation politics. Yeah, when Africans when Africans used to saw that African people are less intelligent, and that's why they restrict them from political influence. They denied their activity in social media. But after 50s, when raised the population of African descendant people with the proper feeding, with the proper intellectual abilities, and so these politics are banned. Yeah, and now white people of Africa, they feel that they were wrong that time, and now they pay the respect to these people, and they pay how to say it, they feel um, um, uh, their fate. No, I forgot.
They are equal, sir.
So now they're equal. Now they're coming to be equal. But even nowadays, you know that we have in America, United States, we have a lot of settlements like ghetto. Yeah, ghetto. So where only African descent people are living, and they have a less proper educational system. They have less public schools are there are very poor, and good teachers try to avoid entrance there, try to avoid working there, because you know that uh, less salaries, less wages are there, and of course quality of education in this schools, public schools, is reduced, and that it's you see it's a feedback loop. Negative feedback loop happens. Yeah, less good teachers come to the ghetto, less African descent people get less education, worse education, and then worse education leads to decreased salaries, wages of this African descent people. And it seems like Africans are less intelligent than European people. So, and this circle is closed. Yeah, and of course they can't afford to get proper education. Yeah, but anyway, so we have exceptions, and example of previous president of America, yeah, like Obama. So just proves that it's not about genetics, it's not about descendants, it's all about their proper. So it starts from feeding, but this circle is continued, and now they try to break the circle, and give a better education for African descent people. That's why this politics of increase the quotas for African descent people in their companies, so in movies, yeah. So it's necessary to break this circle. Okay, many other changes may be present, including thymic and lymphoid atrophy, so which leads to immunity depression, anatomic alterations induced by intercurrent infections, particularly with the endemic helminths and other parasites, so which are very abundant in Africa, and deficiencies of other required nutrients such as iodine and vitamins. Okay, and now let's talk about Western population. So it's a very abundantly present in USA and Western Europe. It's anorexia nervosa and bulimia. Um, so it's anorexia nervosa. So when people are so afraid to be fat, to look fat because of models which are models of wearings, yeah, so they look very thin, and then desire to be same as top models in top models in Western Europe. It leads to anorexia, and they deprive their own intake of food. So and it creates a same and it acquired reason which cause the same symptoms as we can see in marasmus. So here you see this child has no nourishment because of political situation, but in anorexia it's a result of desire of usually females, but sometimes it's also very commonly present in males, to be very thin. But all effects are the same. So also immunity is depressed. Depression of immunity happens, and also cause the liver failure happens gradually, and much more presented is amenorrhea happens due to this. So because in normal formation, as I said before, so in normal production of female's hormones like estrogen takes part not only ovaries but also fat tissue of the body, and absolutely reduced fats in the tissue so cause a decreasing of estrogen secretion, and decrease. So first of all, it's gonadotropin releasing hormone decreased, and also decreased formation of estrogen. And due to this, of course, they gradually become infertile due to amenorrhea. Um, Also, another effect is a decreased thyroid hormone intake, thyroid hormone production, and also and patient became they form cold intolerance, bradycardia, constipation, changes in the skin and hair, and that's why these females wanted to look beautiful, but due to the decreased synthesis of thyroid hormones, they start to look like very old person. Even in 25 years, these girls can look like 40 years old females. Okay, bone density is decreased, so due to lacking of normal hormone metabolism, calcium metabolism, and density decrease and calcium released from the body, and it causes in hypercalcemia it causes cardiac arrhythmia. So, also sometimes can cause a sudden death because of dystrophy of the heart muscle, and which cannot provide the proper conduction of signals along the conductive system of the heart, and also due to hypokalemia, of course. So, but what is bulimia? So, what's the difference between bulimia and anorexia? So, in bulimia, they eat a lot, but after this eating, they used to vomit. They used to vomit to decrease intake of calories to the body. So it's very similar diseases, but they are treated different way. And so it's also it leads to same changes as in anorexia, but also it causes electrolyte imbalance so much harder electrolyte imbalance because when female vomits, it leads to hypokalemia, so and also increase the risk of cardiac arrhythmias. Then it causes pulmonary aspiration of gastric contents. Sometimes happen because they used to vomit and they might inhale this vomit in respiratory tract, which causes a very severe pulmonitis, inflammation of lungs, and the pulmonitis, which cannot be treated by usual antibiotics because it's damage by acid, yeah, first of all, and secondary infection is only present there, but primarily is damaged by acids, and esophageal and stomach rupture. So Mallory Weiss disease. So actually, we have Mallory Weiss disease, usually present in alcoholics, yeah, you understand that when alcoholics during the constant alcoholic intoxication, they used to vomit, yeah, but here we have the same, the tension of stomach, so an increase esophageal stretching, so cause the rupturing of mucosa of esophagus and stomach, and it also can lead to extensive bleeding in the stomach, and also one sometimes cause a death due to profound bleeding in the stomach. There are no specific signs and symptoms for the syndrome, and the diagnosis must rely on a comprehensive psychological assessment of the patient. Of course, there are psychological diseases, psychiatrical diseases, and they should be treated in psychiatry station. Okay, now finally let's talk about vitamin deficiencies. Vitamin deficiencies, one of them we already discussed in alcoholics, thiamine deficiency, so called to Korsakoff syndrome. And I already referred you to this to observe what is this disease. It's okay, but okay, let's talk about all vitamins. Certain vitamins are necessary for healthy for A, D, E, and K. They're fat soluble, and remainder are water soluble. So fat soluble. So what's the difference between fat and water soluble proteins? Because their absorption is different. For example, in case of A, D, and E and K vitamins, they can be absorbed properly even from esophagus, and they absorbed in great amounts. And we have specific conditions in which we have insufficiency of this vitamins. But water-soluble vitamins, they require specific carriers in digestive tract, so which deliver it to the blood, and we can get it properly. We can get it a proper amount. Okay, certain vitamins can be synthesized endogenously. For example, we can say vitamin D. Vitamin D can be produced from precursor steroids. And you know that for vitamin D synthesis we require sunlight, ultraviolet light. A little amount of ultraviolet light will lead to normal vitamin D production. Vitamin D deficiency is discussed in a different chapter. And vitamin K, which is produced by intestinal microflora, and niacin is produced by tryptophan, which is it's also essential amino acid. So you see, deficiency of tryptophan causes the deficiency of niacin. Malabsorption of digestive tract, microflora changes in digestive tract also cause the deficiency of vitamin K. So because normally it's produced by microflora of digestive tract. Okay, then let's discuss it. Endogenous synthesis, a dietary supply of all vitamins is essential for health. So, if vitamins and only these vitamins are produced, actually, essentially in apes, yeah. So we are derived from apes by evolutionary theory, and in most of apes we have vitamin C productive enzymes, but in chimpanzee and humans, this might be in our common ancestors. This gene was broken for vitamin C production, because it happens just because of evolution. So you know that every new population creates some new mutations, and those mutations which don't affect the body health, they can continue their presence in the body. and we have people with animals, so are precursors of chimpanzee and humans. They lost their ability to produce vitamin C, but they lived in a forests. Yeah, and in forests they eat a lot of fruits with vitamin where vitamin C is present. That's why they didn't suffer with scurvy disease, and they easily survived there without this gene which produced vitamin C. But nowadays, when sailors became drill of the ocean, and so we have more. These vitamin C deficiencies are very common, became very common, and now we realize that we have gene. All of us, every person of the world, have this gene disorder, is in ability to produce their own vitamin C. The actual vitamin C production is so used to be produced by most of animals of the world, but in monkeys, in some monkeys and humans, as some type of monkey, we don't have this vitamin C production. So and actually by genetic analysis we figured out so that when it was happened. I don't remember the exact date, but approximately 5 million years ago this gene was damaged, and the common ancestor of chimpanzee monkey and in humans, they have no ability to produce vitamin C yet. Okay, so let's discuss it later. In the following section, vitamins A, D, and C are present in some details because of their wide-ranging functions and blah blah blah. Okay, vitamin A. Vitamin A is also known as retinol, retinal, and retinoic acid. So major functions of vitamin A are maintenance of normal vision. So because they're present in the rhodopsin, yeah, so with their activity in rhodopsin and the protein which is present in our retina of eyes, and is their ability of retinol to convert in retinal due to photon of light. So due to possession of photon of light, it is a main feature, so which let us to use it in rods of our eye. Okay, uh, so they all of them they have similar biologic activities. We have a lot of enzymes which convert retinol to retinal or retinoic acid. That's why intake of each of them so we, uh, can repair the proper amount of this vitamin A. Retinol is a chemical name for the vitamin A. But it's usually we don't intake as we don't have retinol directly in food, and even if it's present in food, it's not properly absorbed by our digestive tract. Um, so, but naturally we intake vitamin A from provitamin A, like carotenes. These carotenes from vegetables, and also we can take vitamin A just from food like meat from meat, and they are absorbed from by our intestine. So then this, as well as I said, this retinol is a part of is a very fat soluble vitamin, so it's absorbed only with the proper work of bile juice secretion, because you remember bile cause the proper emulsification of fat, and this emulsification causes a proper absorption of this retinol, and then this retinol is absorbed, assembled with the chylomicrons, so along with the fatty acids and fat. Along with the fat and with chylomicrons, it enters into the liver, and then in liver this retinol, in a way of retinyl esters, they are transported into the transport to tissues with lipoproteins, and used in our peripheral tissues. Okay, deficiency of vitamin A. So first thing, function of vitamin A: maintaining normal vision in reduced light. So when vitamin A is deficient, so not proper work of rhodopsin happens, and rhodopsin is not working proper, and that isomerization of 11 cis retinol doesn't goes to trans retinol, and this conversion happens due to, as I said before, photon of light. If photo, it's this retinol is used for vision of dark and white, dark and light conditions. And in reduced light, this it's very challengeable for the person with vitamin A deficiency to differentiate picture differentiate pictures, and that's the first symptom which we have in this case. So in you know that we have cones along with the roads, and cones are normal because they don't use vitamin A, but in decreased rhodopsin acting, so in a light decreased light, so in reduced light environment, so they can't absorb properly um, external part. Okay, potentiation, the differentiation of specialized epithelial cells. So actually, we discussed it a little bit in the second set of lectures about cell pathology. So that vitamin A, deficiency of vitamin A, they undergo the squamous metaplasia. Squamous metaplasia, for example, in the respiratory tract, which is similar to changes which are present due to smoking. Yeah, and this squamous metaplasia fails the normal differentiation of cells in the respiratory tract, and fails the normal mucociliary clearance there, and that's one of effects which are present due to retinoid insufficiency. Metabolic effects of retinoid, so they are activated by 9-cis-retinoic acid, so it doesn't matter, so it's not biochemistry, so I don't have to explain the metabolic effects of retinoids. So let's continue. Immunity. Enhancing immunity to infection. Vitamin A supplementation can reduce morbidity and mortality rates for some forms of diarrhea. So diarrhea, just due to the same reason, normal differentiation of the digestive tract cells, the impairment of normal formation of epithelial cells cause malabsorption also, and then vitamin A causes malabsorption and increased diarrhea of these patients. But also don't forget that we have extensive. Oh, okay, let's continue. So this affects. Yeah, so this affects of vitamin A deficiency. So we can divide them into eye changes and cell differentiation changes. Eye changes include the keratomalacia, so which is present on the iris of eye. Also cause a corneal ulcer, also the challenge the vision, and bitote spots, keratinization of cornea. And then and they challenge its cell differentiation from normal to transition to metaplasia, and it causes epithelial metaplasia. Squamous epithelial metaplasia, which affects not only lungs but also digestive tract and also urinary system, and risk of cancer is also might be increased. So we have no not clear results of this, but just logically thinking, so we can say that might be it increases the cancer rate because of loss of differentiation of cells. So metaplasia is very close to dysplasia, and dysplasia is impaired division of cells might cause the cancer. Okay. Um, but vitamin A might be toxic. Increased amount of vitamin A might cause is a headache, dizziness, vomiting, stupor, and blurred vision. And they can be confused with a brain tumor. So, and why it happens? So actually, more predominantly, as a cause of it is predominantly it happens in Arctic people, so who eat the liver of polar bear. Polar bear, the liver of polar bear, they collect a lot of vitamin A. It's necessary for their survival. But when we eat this polar bear liver, so it causes to increase the level of vitamin A, and that's cause the that causes changes. And also don't forget about teratogenic effect of vitamin A. So to increase amount of vitamin A intake in pregnancy also causes teratogenic effects, so causing a lot of large set of embryonic changes in pregnant women. So in children in child who are affected. Okay, let's talk about vitamin D. Vitamin D, so you know that vitamin D also calciferol, so tococalciferol. So we have a lot of different states of vitamin D, but vitamin D is majorly there. We don't eat it itself, but we eat precursors of vitamin D, and from cholesterol-like components is produced. Vitamin D is produced predominantly by our skin due to exposure of skin with the sunlight. And this vitamin D and deficiency of vitamin D is known as rickets. So if it's present in child, and in adults it can cause osteomalacia. And you can and now you heard about vitamin D deficiency. It's usually happening with with persons who are present in northern countries without proper exposure of ultraviolet light. And now we treat it with ultraviolet lamp. We have a lot of ultraviolet lamp, and that's from childhood in areas like London. So I mean, United Kingdom, which has very moist and cloudy weather there, with a less ultraviolet intake of people. They use ultraviolet lamps to produce proper amount of vitamin D. Uh, what is caused by vitamin D insufficiency? Of course, proper exchange of calcium is challenged, and calcium is not deposited in proper amounts. And this D3 vitamin D is used. Vitamin D is irradiation of so formation. So firstly forms the cholecalciferol is from cholesterol is produced, and also known as vitamin D3, and is present in skin, and depression of them causes improper calcification of bones in childhood, and that leads to so now I'll show it on this diagram. So first of all, it leads to changes in bones. Yeah. Now, when you discuss the histology of epiphyseal plate of the bone, you remember that we have endochondral ossification, and due to the growth of bones, so we have this is normal picture of this bone growth. This we have to so here we have normal production of cartilage. From opposite side, we have a formation of bone, and this is normal picture. But here, formation of bone is challenged because of improper calcification, and then cartilages are growing, but it's not replaced with the bones, and that's why in these patients have a lot of so increased cartilages. And cartilages they are not so rigid here as bones, yeah, and that they endure the posture, as we see here. Now these cartilages can be a little tilted, unlike bones, and that's why manifestation of this we can see by curvature or increased curvature of long bones, especially lower limbs, and because muscles are pushing it, yeah, and that causes curvation of the bones, and specific appearance of these bones are happens there. So they're curved along with the strong muscles. So because strong muscles, with the help of tendons, they tilt this bone, gradually tilt this bone, and then cartilage, when even bone growth happens, but they are grown in a specific arrangement. Is instead of a straight line, they start to grow in a C line. So C-like bones are present. Okay. So this is
Sir,
yes.
sir, then it will be necessary for the children to give a proper sunlight. Most people they protect the children from sunlight. At least they should give some sunlight.
Yes, yes. So actually, even in our country, for example, when child borns in a cold weather, they recommend doctors should recommend them to walk around. So at least with open face or hands. Yeah. So some parts of skin should be opened for the sunlight, and for ultraviolet to produce at least a little amount of vitamin D. But actually now we have a lot of supplements which we can deliver to baby to produce to facilitate the normal amount of vitamin D, but we have to control it, of course. Um, so here's the metabolism. So vitamin D might be absorbed by small intestine from dietary sources, or by supplements, or by ultraviolet radiation of 7-dihydroxycholesterol in the skin, and produce vitamin D in blood. And then liver produces D25 hydroxylase and D25 hydroxy vitamin D. So then absorbed, then challenged, then how it's metabolized in kidneys, and it increases the calcium resorption, so reabsorption, then increase calcium and phosphorus absorption in small intestine, and then normalize the serum level of calcium. And it also vitamin D is taking part in mineralization of bones, and that's a mineralization of bones happens with a normal amount of vitamin D. Okay, but in case of vitamin deficiency, so phosphoric acid is released. So phosphoric acid is water soluble, yeah, and that's why phosphoric acid is easily removed with the urine. So in decreased 25 hydroxy vitamin D, so it causes a decreased calcium and phosphoric absorption. So it's causes a decreased serum and serum calcium and phosphoric acid in a bloodstream, and it causes formation of more parathyroid hormone in a parathyroid gland, and it causes mobilization of calcium and phosphorus from the bone. Instead of deposition of calcium and phosphorus in children, it causes mobilization of calcium with the osteoclasts, and it increases the calcium serum and phosphoric in the blood, so maintains the normal amount of them in the blood, and that leads to poor bone mineralization. Okay, let's continue because we have no time to discuss it, some details. We have a skeletal, non-skeletal effects. So, okay, now let's talk about scurvy disease. Scurvy disease. So let's talk about vitamin C first of all, and then scurvy disease. As I said you before, vitamin C was normally produced by most of animals, but in humans and some monkeys, so like chimpanzee, this vitamin C production is decreased. So not decreased, it's absent because of gene damage, and all of us have this gene disorder. And it became obvious when we became so when our so in 18 so starting from 15th century, so a lot of sailors are present, a lot of sailors drain their oceans, and they never thought about vitamin C. We never heard about vitamin C before, so in the 15th century, so no one thought about this vitamin C. We didn't have so evolved medicine, yeah, so evolved chemistry, and they eat only meat. They drink only alcohol drinks, yeah, and a little bit of water, because meat, so dried meat, so it cannot be spoiled during the journey. But citrus juices, yeah, or other so any products which contain vitamin C, they very easily spoiled during the journey. That's why they didn't take these products, because they didn't know about the scurvy disease. And most predominantly sailors, they suffered with the scurvy disease. And so what's the function of vitamin C, and what happens due to deficiency of vitamin C? First of all, ascorbic acid acts in a variety of biosynthetic pathways by accelerating hydroxylation and amidation reactions. And hydroxylation of proline proline is the first thing which is suffered. So you might be remember that in the formation of collagen, in collagen, every third amino acid is a proline. It's actually oxyproline. Oxyproline, which so usual proline doesn't give the strength effects for the collagen, but oxyproline. So it leads to very strong connection between. So it leads to normal the strength of this collagen fibers in tissues, and we can so they're very strong, and absence of vitamin C cause the loose formation of loose connective tissue instead of dense connective tissue. And this loose so, and first of all, it's visible in teeth. Yeah, tooth is surrounded by fibers. Yeah, tooth surrounded by very dense collagen fibers around. And when synthesis of these proteins is decreased after 100 days of vitamin C deprivation, 100 days of vitamin C deprivation, this the proteins, they became a little senescent. Yeah, they became senescent, and then tooth start to fall out of the mouth because of what? So because of losing of periodontal connective tissue. So that's the first idea. The second idea is that blood vessels, yeah, blood vessels are also surrounded by connective tissue, also surrounded by reticular fibers, and not only reticular but also collagen type 1 fibers are present there and keep their integrity. And due to this Scarby disease, bleedings are very common because everything which supports the blood vessels get very fragile, and blood vessels became very fragile, which leads to petechial rash on the skin, and also very a little pinch of the skin will cause the bleeding. So subcutaneous bleeding. So that's why that's why we have this deficiency states. And also vitamin C is approved that it prevents the cold diseases. Might be heard that to prevent cold disease you have to eat a lot of vitamin C. Actually, it is related to connective tissue of our nasal cavity, the nasal cavity mucosa. In nasal cavity mucosa, the integrity of nasal cavity mucosa don't allow the viruses to penetrate to subendothelial layer. It is a very good barrier for viruses, and integrity of this don't let the inflammation in nasal cavity. But decrease the vitamin C level in the blood, so cause the same as I said senescence of collagen fibers, and it increases the possibility of inflammation in nasal cavity. And inflammation causes the distribution of these viruses all over the nasal cavity and furtherly in down parts of the respiratory tract, and it increases the risk of complications of usual rhinitis. Okay, toxicity. So toxicity of vitamin C is not very not very well established because it's very hard to overdose of vitamin C. So, and actually some studies were shown that mega doses of vitamin C they can decrease some viral infections like poliomyelitis. It's not confirmed yet, actually. Also, it's ascorbic acid. Mega doses of ascorbic acid are necessary to treat other viral diseases, and sometimes even we had some effects of mega doses of vitamin C can kill even cancer. But all of this is not established yet, and it causes overload to our body. So that's why we can't claim that vitamin C mega doses are good, but still you have to keep it in mind that there are a lot of studies about vitamin C activity. So, but increased vitamin C uptake, so it's might damage the digestive tract because of their acidity properties. Vitamin C is also known as ascorbic acid, and this ascorbic acid increases the acidity of the stomach and also might cause gastritis and sometimes even ulcers. Then we have here on this, so I hope you observe this table later, so it's necessary for yourself later. And if I'm not mistaken, here starts the topic about obesity. So obesity is for your self preparation. So because we have no time for it. So what is the leptin, by the way? So how obesity affects our body, metabolism. You should learn by yourself. Okay, a little bit we'll discuss it in our last lecture about atherosclerosis, how obesity affects the body. Okay, next lecture will be about infectious diseases, pathology of infectious disease. Now I'm checking your attendance. Okay, so let's compare it with the chat. So now I see that much more students typed in chat, but they are not present here.
Sir,
Yes?
we write in the chat.
Yeah, I
Yeah.
see that a lot of people who wrote in the chat, they're not present right now in lectures, so that's why. So here someone asked to join someone, but I said it's too late. So I add only students who join at proper time. Okay,
But sir, we cannot write the name in the chat, sir, in the previous classes.
you should have write it. Right. Okay.
Okay.
Okay. Thank you. See you next time. Goodbye.